Welcome. My name is Fred Sandoval. I'm the Executive Director for the National Latino Behavioral Health Association, NALBA for short. Thank you for joining us today for our Plática called Take Action LA County. With me today is our esteemed co-host, Ana Chavez Mancias. She's NALBA's Program Director. She'll be introducing herself shortly and our guests. NALBA is a nonprofit organization dedicated to the well-being of Latinos across the United States, for individuals, families, and our communities who are oftentimes experiencing behavioral health issues, and we get to talk and address them during these pláticas. We're excited to present this particular series called Take Action LA County on reducing stigma and connecting community health services to the people who are seeking those services. And this is in much credit to, of course, the County of Los Angeles Mental Health Department for making this series possible through the end of this month of June 2023. Plática, as you know, is the Spanish word for conversation. So today we're going to have a conversation with our incredible speakers. We're excited about having them with us today, and more importantly, for you to be able to hear about their services, about how you can access their services and be able to really get their expertise, their opinions, and stories about how to be of service to you in Los Angeles. We, of course, want to be able to speak to our presenters in such a way that you can feel that you can ask them questions, make comments on the live Facebook chat. So we're going to encourage our live Facebook audience to please send them questions, make comments. Today is going to be a very powerful way of learning about how we can improve the wellness for the Latino community here in our county of Los Angeles, and to be able to find providers like them who can make themselves available and accessible to you. Well, so let's begin our plática by having our co-host, Ana Chavez Mancias, introduce herself, our guests, and then we're going to get started because we already have some questions to ask our presenters. So Ana, if you would please introduce yourself and our co-presenters, because we have two of them here with us today. So please.
Yes, sir. Well, hello, everyone. My name is Ana Chavez Mancias, and I am the program director for the National Latino Behavioral Health Association here in Los Angeles area. I live here in the beautiful city of San Dimas. Prior to my work with the National Latino Behavioral Health Association, I worked for Pacific Clinics for over 19 years, providing bilingual and bicultural mental health and substance abuse services to children, families, and youth. Now, allow me to introduce our wonderful guest. I am super excited to be here with them today. And I'm going to start with Dr. Patty Ramirez. She is a transnational social worker, healing center facilitator, and advocate who earned her master's and Doctor of Social Work from the University of Southern California. She is the founder and CEO of Colibri, a grassroots organization with the mission to uplift and sustain advocates and leaders through the ecosystem of care, well-being, and healing. Dr. Patty is Chicana Indígena and Salvadorian and is passionate about embracing her ancestral medicine and practices in her work. She has dedicated her work to serving immigrant victims of crime, unaccompanied children, asylum-seeking individuals and families, and justice-impacted people. Now, our other guest is Itzpapalotl Patino. She is an indigenous jewelry designer, traditional yoga and Yogha Mayan, and meditation instructor and collector of vintage and antiques. She is passionate about work that can bring joy to her community and, most importantly, to herself. As a Public Health AmeriCorps Fellow at Colibri, Itzpapalotl supports community health projects that benefit Latinx and Indigenous youth and social justice leaders. Itzpapalotl is also a certified Sinchantli Rites of Passage facilitator and hopes to facilitate youth círculos, where youth can be exposed to traditional musical instruments and Azteca, danza Azteca. So welcome to both of you today. Again, super excited to have you. Fred, back to you.
Oh my God, what a wonderful introduction of our co-presenters. And well, let's just jump into it. I think what's important is to acknowledge that we do have folks already live on Facebook tuning in, and we want to welcome all of you who are joining us right now and will continue to join us. But well, I think that introduction was so important because it helps our listening audience learn about our two speakers. But we would like Dr. Ramirez, of course, and Itzpapalotl to be able to kind of say a little bit more about themselves. So, Doctora, we'll start with you, and then we'll go over to Itzpapalotl, so she can say a little bit more about herself.
Oh, of course. First of all, thank you so much for having me and us here. We're excited for this Plática and have been just really building the energy up until this point. I want to just share, that I am coming to folks, not just as, the founder of Colibri or a social worker. I am first and foremost a daughter, a sister, a sobrina. I am a madrina. I have, beautiful godchildren. I am, a community member here. I was born and raised in East LA. And so I'm still, very connected to home and to my communities. Even though I'm no longer in El Sereno, I'm not too far. I'm in Monterey Park. But, all of that to say is that I am someone who really loves my community, really is dedicated to ensuring that we all can heal so that we all can thrive, right? I feel like we've been in survival mode for a long time, especially, following this global health pandemic. And so, with that said, I just wanted to offer that grounded introduction as well. And I'm excited to share more about myself and throughout this time together, but also about Colibri.
Yeah, we're absolutely waiting to hear about Colibri, and of course that's a hummingbird, right? Description, so it's a very symbolic image about what does it really mean. So we're going to want to learn about the significance of it because of how it's defined across the continent. So, Itzpapalotl, let's have you introduce yourself, say a little bit more about yourself, so folks get to kind of get to know you. So, please go ahead.
Yes, thank you so much. I'm so honored to be here. First and foremost, thank you so much for having us. My name is Itzpapalotl, and I too am a daughter. I'm a sister, and I'm a mother. I am a certified yoga and meditation instructor. I am an initiated student of Mayan elder and solar daykeeper Unbatsmen. And by trade, I'm a jeweler. I'm a jewelry designer, a jewelry artist, and I love creating powerful, significant, and healing pieces for my community. I am also a public health fellow with Colibri, and I'm also a traditional Mexica, danza azteca, and a drummer here within our communities. And I'm just so grateful to be here. Thank you so much.
Oh my gosh, well, such deep and rich histories of your families, your ancestors, and your place of origin, ¿verdad? Thank you for being able to now bring to light the significance of culture and language in your work, by the way. So just as we can help inform people about your services, please be generous in your description about what are the significant cultural and linguistic attributes. It is very significant in the communities that we serve. So Anna, I think we're ready to kind of springboard over to the next question. So I know Anna is like anxiously waiting here to get with the next question. So Anna, go ahead, please.
Yeah, absolutely. So a question for both of you. Can you tell our listening audience about the services provided by Colibri and who you guys serve? Dr. Patty, we'll go with you first.
Yes, thank you so much. I'm always so excited to share about Colibri because, it was something that I birthed, right? It was an idea that became a prayer that became an offering for the community. Colibri, if you look at the spelling, you might not get from it right away that it's meant to be a representation of hummingbird, right? Colibri in Spanish. It's not spelled with a K and it's missing some vowels. But all of that to say is that colibri, it represents a hummingbird, and in a lot of traditional cosmovisiones, like in Mesoamerica. So I'll kind of speak about Mexica and Maya traditional symbology. The hummingbird has come to represent, even in Purepecha culture, like the healer. It's represented messages from our ancestors themselves. But in other traditions, the hummingbird has represented the warriors that have fallen in battle. And so when I created and birthed Colibri, it came from the context of having been for over a decade in the immigration field, supporting and working directly with communities impacted by trauma. And what I was noticing is that many of us who were doing the work ourselves were not just directly impacted, but we were being re-traumatized through the work, and which was causing our burnout. And so if we are in survival mode, how can we show up for others who are also surviving? So I thought, how can we honor and uplift, and how great would it be to have an organization that focused on those that are out there in the communities interfacing with folks who are vulnerable and who need support. So that is, the birth story of Colibri. And, I'm really happy because although we're still an emerging organization, as a startup grassroots, we are building a new ecosystem and really reimagining what it looks like to heal in community. So yes, I wanted to share that, and I would love, to have Itzpapalotl, share a little bit about maybe, some of the work that we are doing with communities, but also how it's resonated with her, if that's okay.
Yes.
Thank you, Doctora. So one offering that Colibri has that has really touched home for me, being someone who has struggled with mental health and also having mental health issues within my family, is we are offering free mental health first aider trainings within our community. So our goal for Mental Health Awareness Month, and of course the continuing months, right, because it's a year-long struggle, was to train 300 individuals within our communities with our mental health first aider trainings. The mental health first aider trainings will certify the individual for up to 3 years. So it's something like a CPR certification, but it allows the individual to recognize when somebody is struggling with mental health issues and how to address them, how to speak to them. It also gives the person amazing contacts to call, right? Instead of just contacting 911, we see how that's become problematic. So it gives them real resources to contact and real context to be able to speak to people. So that's one of the beautiful offerings that we have here at Colibri. Thank you.
That is excellent, Itzpapalotl, that you guys are, so your goal is to train 300 people in the month of June as part of your project. Wow. Is there any other offerings that your agency has? I know that you said that you hold círculos and also drumming. Are there any offerings of those types within the agency?
Yes, we do. We offer many talking circles. I know we have Cafecito with Comadres, which is a beautiful offering as well. It's a monthly offering that people can join. And it's just basically for women all over, not just here within Los Angeles, but we also have some Comadres in Arizona and from all over the state, coming in, linking in to just speak about issues that are affecting our communities. allowing a space to speak, to be heard, and also to hear others for different perspectives.
Wow, I want to come and have some cafecito with the comadres. That's always like so much fun. Okay.
Join us. I'll send you the link.
That'd be excellent. And maybe that is something that we can also, share with our audience. I'm wondering if we're able to share that link so that anybody that wants to come and have cafecito, bring cafecito con el panito, like we say in my home country of Guatemala. We can go ahead and we can join you and join, those important conversations that are so needed for our communities, right? Because a lot of these issues that we're talking about, mental health and trauma and all of that, are kind of sort of taboo, right? Those are things that we want to keep at home, that we don't really want to talk to other people or strangers with, right? So creating the ability for you guys to create this space is just so wonderful. So I think that's great information for our listening and audience this morning, and those watching today as well. So if we can share that, that would be great. And in any other groups that you may be having, if there is a way for people to register for the mental health first aid training, if there's a direct link, we should also probably post that. So maybe we can add that to the chat and give all that information to our listening audience today. I think extremely, extremely important. So Dr. Patti, are there any other things that Colibri is doing out here? My goodness, this is such wonderful information.
Yes. So a lot of the work that we're doing is geared towards healing-centered leadership development. And so we do work and offer organizations and groups, Círculo programs that can support the healing and resilience of, ultimately social justice leaders, organizations, and communities. Some of the work that we've been able to do in Los Angeles has been with our street vendor community. We've been able to partner with CPC, Community Power Collective, the LA Public Library, along with Inclusive Action, Latinx Therapy. And together we were able to do an app program that is available through the LA Public Library called Be a Successful Street Vendor. Colibri's work within this project was specifically around community safety and wellness, because a lot of what the street vendor community was sharing was that they are experiencing not just violence and criminalization, but then they're also bringing their own trauma from, whether it be their migration stories, from interpersonal violence, or just systemic oppression that is very prevalent. And so we were able to develop 2 units that were created specifically for street vendors in collaboration with street vendors, right? That provided strategies for empowerment, for bystander intervention, and ultimately included some information around mental health and wellness. One thing that I love to add is that the way that Colibri does its work is very different, because we know that we can't do this type of work without being ready to support the community, right? So within this project, we paid for mental health services for our street vendors, and they were able to access weekly and individual therapy, group and individual therapy throughout the duration of the project. I'm happy to share that this has expanded, and currently we're in the process of working with the San Diego street vendor community. And so we're doing some interviews next week as we speak to continue that work and really bring about the narrative on how can we invest in healing for street vendors and other vulnerable communities. Lastly, I really want to highlight our She Naturally rites of passage work. So She Naturally, it stands for Germinating Seed, and this curriculum itself is a youth rites of passage curriculum for Brown, Indigenous, Latina girls and gender expansive youth. And so we offer this curriculum in 2 ways. One is we offer it to the facilitators themselves. So you might have heard Itzpapalotl mention the comadre cafecitos. Those are typically attended by our naturally facilitators, and we build their capacity to do work with girls all around the country through these cafecitos, right? And so we also offer them their own rites of passage, because many facilitators we found were saying we could have used this when we were little, right? And so there's a lot of healing and wellness that comes through their participation in these círculos, so that they can come back to their communities and be regenerated and have an increased capacity to support those that they're supporting. So I wanted to highlight those as well.
Wow, how wonderful. These are all great services. And I just love the idea of being able to provide mental health services, which could be very expensive if done privately, to street vendors, especially because, we know that street vendors are probably mostly immigrant, right? From our Latino communities, and most of them are probably undocumented. Therefore, they don't have access to any of these things. So this is such a wonderful service that you're offering. So for our listening audience, if you're needing services, for this particular population, I mean, definitely Colibri is the place to contact, and getting in connection with either Itzpapalotl or with Dr. Ramirez. So, wow, this is such great service to our community. Definitely. And I love the idea of the circles for the girls, and not only here in California, but it's becoming a national movement, right? That's wonderful. I'm gonna sign my girls up. Right? Because this is like you said, it's so needed, right? And it brings healing in a different way, right? Not the way that we know healing here in the United States, but that whole holistic idea that there is more to us than just the physical and the mental, right? There is also that spiritual piece that needs to be tied in, and I think that's part of the work that Colibri is doing as well. Any thoughts on their services, Fred?
Well, I can't tell you how impressed I am about the spectrum of what you do, first of all. Second, the significant value of the traditions that are really being used in a modern context. And then the last thing is, I so greatly appreciate the fact that it's so rooted deeply in the community, ¿verdad? In Latino communities, and we use that term broadly, by the way, but in terms of the work that you're doing, particularly in your area, it will be probably more specific to Mexican American, Mesoamerican populations. But the point being is what's important. It's so grounded deeply in the community that it's a representation of what works in those communities. And at our organization, we refer to that as a community-defined evidence program or practice. It's defined by the community, it's run by the community, it's evaluated by the community can show how it works, and just kudos to you for doing it that way. And then just as Itzpapalotl had given an example of mental health first aid, well, it's a more modern curriculum. It's really trying to bring information and education. In the Latino community, we're starving for information about this thing called mental health. We tend to think of it more in terms of our personal wellness, ¿verdad? El bienestar de la persona, right? But the two have a strong connection because it's about the person and their well-being physically, emotionally, and spiritually. So except that in the traditional programs that you're doing, you put great emphasis on the culture and the spiritual aspects of it, which many mainstream programs tend to shy away from. We recognize the intrinsic value of presenting it the way you are. So congratulations. All I could say is that the resources you have are particularly important for other groups to learn across the country. And so thank you for putting your links on here. And you already have people already asking questions. We probably, I'm not going to ask a question. I'm going to use one of the questions from the chat. And we have a question from Dolores. And she asks if that is similar, and what she's referring to was the mental health first aid, by the way. So is mental health first aid similar to QPR, gatekeeper training, which is a suicide prevention approach? And so she wanted to ask you if that's the same thing or is it different? And then we have another question after that, but this one's to both of you. So okay, it's Papalo. I'm going to just direct it to you because I know you brought up mental health first aid, and then we'll ask Dr. Ramirez to add to that question about is it the same as QPR?
Thank you for that question. I'm not aware of QPR, so I'm not sure of the similarities. But within the mental health first aider training, we do touch on sensitive topics such as suicide and suicide awareness. So I hope that answers the
Perfect.
question.
Well, that's very helpful because the two are associated to each other. So we'll see if Dr. Ramirez wants to add anything more to that question, and then we'll ask you the next question that came up on the chat.
Yeah, and just to kind of reiterate what Itzpapalotl was sharing, within the mental health first aid curriculum, which is a full long 8-hour curriculum, folks are able to learn how to recognize the signs of a substance use or mental health challenge. And we're able to kind of walk folks through what does it look like to apply the action model that the mental health first aid curriculum offers, which is called ALGE, how to apply it to different contexts across the spectrum. So, kind of like the beginning, when someone is first experiencing symptoms versus when the symptoms are worsening, versus when they are in crisis. And so, although I have not taken the QPR gatekeeper training, so I can't really speak about the similarities or differences. What I can say is that, the mental health first aid training is really trying to ensure that folks are equipped to support in a wide array of contexts. But also, I think the other piece that is really important is that there's such an emphasis on culture and cultural considerations that are important for us to keep in mind. As when we think about mental health and substance use, and there's such an emphasis on self-care and community care, and knowing that when it comes to helping our own loved ones, it can be so tender, and we might not always be the best person to support and respond because we might need that support. And so there is, some of the work that we do with folks when we train them is really normalize that, yes, you can walk out certified, but you also get to discern whether any situation requires additional support. And ultimately, everyone is the expert of their own experience. And I can't tell Itzpapalotl, oh, you should be ready to handle this. Rather, all that I can do is say, do you have the capacity? And if not, how can I help, right? And so we as a cohort now get to really support each other even beyond, the training, which I think is really, really powerful. The other thing that I'll just add is, as it relates to our cultura and our tradición, a big part of the conversation does take place around the stigma of mental health, right? And how in many of our communities or in many of our families, mental health has often been played off as a personality. Oh, ellos nomás son berrinchudos. When in fact, they might be experiencing anxiety or depression, or this person might be in distress and it's being expressed as anger, right? But it may be that they have an undiagnosed mental health challenge that they don't know how to work around. I know for me, as my stepfather had been in the Salvadorian Civil War, And, he also was struggled with alcoholism. And growing up, I didn't understand that, oh my gosh, this person had PTSD, right? And trauma from this war. And, I didn't comprehend that until my master's program when I interviewed him. And like got all of this story and was like, it's not his personality, like these are, mental health challenges that our communities are, facing and experiencing, and often, just writing off as that's just how people are.
Mhm. Wow.
Well, gosh darn. I don't know about you, Anna, but I was like totally like, listening to everything
Yes.
Dr. Ramirez said because we're having this conversation. ¿Cómo te parece?
Yeah.
20 years ago, 40 years ago, 60, this conversation wouldn't have been taking place in a way that we can help others, ¿verdad? So estamos ofreciendo el apoyo, no, we're offering our support and give role modeling how to say these words, how to talk about them, because one is it's not offensive, it's not to make people feel bad or shamed about their experiences, it's to say, "Sabes qué?" And what a perfect symbolic image, right? The warrior spirit in all of us, right? Of the colibri, right? The
Wow.
warrior spirit about how it is that even the warriors get injured,
Right.
and even the warriors can suffer great consequences, right? The warriors oftentimes may fall prey to something that does them do harm. You get a great example of your relative, right? To give us an example of how people are traumatized in their life experiences. And that's not something to minimize, but it's a way of learning. Then how do we help heal people or help others learn how to heal themselves? Or how do we do it collaboratively with them? And so I am just so impressed by the approach that you're using. And I think as mainstream society starts to learn about these things that we do, how
Mhm.
they can no longer reject it or dismiss it or discount it, but learn and develop the cultural humility to apply the knowledge and the practices by us teaching them how to use these methods. The fact that science hasn't given us the time or the resources to study it doesn't make it less than. And in fact, it increases the value of what we're teaching, because part of that is our job is to serve others that are suffering. So all I could say is, oh my God, this is such a wonderful plática, and we already have several people asking several questions on the chat. So, Doctora Itzpapalotl, I'd like you to, after today's plática, if you can come back into the Facebook and answer some of those questions, because gosh, we have a few more things to ask you about, but we want to thank our Facebook listening audience who are asking questions because they want to know more. So Wes, you've already done it, right? You've already kind of gotten people's attention. So let's keep this plática going on, not just now, but después, after this too. So Ana, I'm going to just turn it over to you because I think I used my time for the questions from the chat. But go ahead.
Yes. Thank you, Fred. No problem. So our next question, and what we want our listening audience to hear from you and those watching today is how can your agency help involve the community to reduce the negative impact of the stigma? And I think you've touched on it and with the several programs that you are providing, but can you expand on that and tell us a little bit more about that, how you're involving the community, because you are doing that at like so many different levels. But can you guys expand on that? Dr. Patty?
Yes. I mean, I think, first and foremost, it's creating the opportunity, the place, and the space for folks to come together and have these pláticas, right? Especially after the pandemic, I think isolation has been such a big a risk factor for mental health and other challenges. And so creating spaces for folks to even just process what they experience, I think is one way that we can involve the community and, destigmatizing mental health and substance use. I also find that, like, at least, with our Spanish speaking offerings around mental health for mental health first aid, we had so many folks that were talking about this for the first time. And it was so hard to like take them through a training that is very rigorous. It's an 8-hour training. And the señoras just wanted to talk and, oh, mi comadre tiene esto y fulano tiene el otro. And for some reason, like they couldn't, and me being like, I was educada to like not interrupt elders. So so here I'm like, oh my gosh, how can we like one, take advantage of this opportunity that folks are talking about this for the first time, and two, like honor that this is the training and we need to take them through these 8 hours. So I share this because this to me is telling me that the community is craving these spaces to talk. And in fact, there's a few community members, including here, not too far from us, Tata G is, providing talking circles for communities under, Take Action LA, to really be able to continue to process these. So, I just want to kind of like share this with you all, because for me, it was one of those moments where even at Tia Chuchas yesterday, we did another plática, and at both we were like so surprised with how much folks want to talk about this, and how they're ready to like move through the silence of mental health and substance use. The other thing that I do want to add just very briefly is that for communities that maybe are still experiencing blocks and resistance around stigma of mental health, some of the work that we can do and that we at Colibri do is create containers where we build the skills and the capacity of community organizations or just groups in general, to be able to have the skills to have these pláticas. What I mean by that is that for many of us, we need to learn how to sit in discomfort.
Mhm.
And we don't know how to, or we need to be able to sit in our anger
Mhm.
or in our grief. And
Mhm.
so our círculos, some of the ones that you all have heard about, some of them do that very work of just helping folks together build that skills, so that then we can say, let's talk about mental health. Let's talk about racial healing. Let's talk about social justice and human rights, which is all of what our círculos tend to talk about. I don't know, Itzpapalotl, if you want to add, or if there's other things that feel alive for you.
Mhm.
Yes, so just to reiterate too, something that Fred had said earlier is that our communities are starving for this information. So, like Dr. Patty said, creating the container and the space to bring up these topics. Another thing that I wanted to bring up was, out of our 300 offerings that we gave to the community, they were almost all of them were claimed within the first day. So this is how
Wow.
deprived our communities are of these topics. Like Dr. Patty said, they didn't want to stop talking about it because these topics do carry a stigma with them. So creating these safe spaces for people to speak, to talk, to be heard. A lot of times we see these symptoms within our own families, and like Dr. Patty said, we just write them off. Oh, they're just sad. Oh, that's just them. So learning how to approach these symptoms and being able to provide real resources has just been such an amazing impact on our communities.
Oh gosh, all I could say is I'm completely blown away by this plática. So let me just say that this is exactly the conversation that takes place in the communities, right? What happens is sometimes people are telling our narrative for us. We need to tell our narrative, right? con la boca cerrada no entra la mosca, but of course the truth of it is what? Is we want to talk about it. We want to express ourselves. We just need to have a safe place for it. We need to have a place where people's opinions are respected. Because, anytime we meet somebody, right, or somebody we know, usually what the first question that we ask, ¿Cómo estás? That's the portal to a person's soul when we ask that question. Porque cuando te ofrece una respuesta, right, when they answer your question, it may be so deep that it'll probably just blow you away, right? Because the surface response would be, oh, I'm good. Y alguien otro va a decir, I need to tell you, man, I've been experiencing a lot of emotional pain. And then are you ready to hear that conversation? And how do we do that? Because we're inviting it by asking a person, how are you? So it's like that well, esa noria is very deep, right? But I really love the way that you've expressed it. I think it's exactly how it takes place in our country. So I appreciate your describing it just precisely how you're approaching it. It is very appropriate. It is in fact, the correct way of engaging with the communities, and it's centered in the community. All I could say is, I don't know if I can give you an Emmy Award for what you're doing, but I would simply say, Anna, this is the group that really is modeling community-based approaches that are culturally and linguistically appropriate. That's a fancy way of saying, the mainstream system understands what you're doing, but they may not know how you do it. But so thank you for your offerings. And how did Fernando Gonzalez say, thank you. I wanted to learn more about stigma and got the answers. So ves, here it is, right? Una plática, question, answer. It's really that simple, right? But the truth of it is our systems overcomplicate things. There's a need to scientifically articulate our interventions. Y nosotros, la comadre or la abuelita, she wants to know, ¿Cómo estás, hija? And the simplicity of that question is a complex dynamic, right? And we don't have to have science to prove that it works. And the reason why is because it does work. We just lack the resources for research to really study these things. We hope that they can pick up the pace, catch up to us, learn how the community does it, because we want to do more of it. So, Ana, all I could say is, ay, válgame Dios, time is passing us. And I'm like saying, can we maybe bring these incredible presenters back? I think the approach they're using has great value across the country. And I think we should provide a venue, a vehicle, and they can bring the voice to be able to express this even more. So I don't know about you, Ana, but I'm all excited right now.
Most definitely. I mean, I was going to ask them about a little bit more about their drumming circles. I've done drumming circles in the past and they are wonderful. And I'm just wondering if you have any of those scheduled. How can the community access those? I mean, they are just such a wonderful tool as well. Dr. Patty, would you like to respond?
So I was gonna let Itzpapalotl respond. So Itzpapalotl is a drummer. We don't offer the drumming circle, so I'm so sorry that got kind of mixed in there. But hey, if the community's asking for it, then we must, right? I don't know, Itzpapalotl, what you were gonna add.
Yes, so I am part of the Danza Azteca community. I am a dancer and what they call a huehuetera. I play the traditional Mexica drum, the huehuet. And the huehuet is our grandfather. Hue in Nahuatl means grand. So huehuet is like our grand. And the drum comes from our heartbeat, which is one of our greatest attributes, right? Our heart. So in the community, we offer free classes Monday, Tuesdays, Wednesdays, and Fridays. They're with different grupos or what they call calpulis, but the ones that I go to are all open. I could definitely put a few of the dates and the locations and times on the group chat right now, and everybody's welcome. It's an open circle to learn traditional Mexica dancing and traditional Mexica drumming. I'll put that in the chat for everybody.
Yeah, that would be wonderful. Thank you so much for adding that. Again, all these great things that are that have that cultural component, I think is definitely important, especially for our, again, our Latino communities here in Los Angeles, who may or may not have access to, to mental health services or, other services for X or Y reasons, right? So, but, if they have access to something alternative, right? I think it's a great way to connect them and a great opportunity to have this important conversations with them as well, right? And educate them. And as we have heard, they are like so hungry and they are starving for this information, right? They want this information, which is why the mental health first aid is such a great tool, because that's what it provides, right? It provides training. It's an educational tool so that they are able to identify the various mental health illnesses and so on and so forth, and kind of walk through the process like, okay, and this is what you can do, and you can go here, and then that referral piece, right? So yeah, most definitely. Thank you for sharing all of that, and thank you for sharing the links in the chat. So did you have anything else, Fred, for our guests?
I do. I asked Elizabeth here at NALBA if she could send me some information, because I wanted to give you an example. In the Latino community, and again, bear with me for using only that word to describe, which is a very broad range of populations but it really speaks to the natural support systems in our community, and I like to say our raza community, right? We have a natural support system that's very powerful. And in that support system are the very characteristics that you both are talking about who it is that we do talk to about it, and what does that look like? You're describing what is a natural support system of how people do talk about these things. And the way they're doing it now is meaning that when people are hungry for information, they're turning to somebody for information. Well, you all have heard of a program that's been around in the United States for a very long time, and it actually is rooted in a support system, right? It wasn't part of the mainstream system. It wasn't part of a scientific project. It was something called Alcoholics Anonymous, which went viral across the globe, right? So it's an example of a natural support system that goes viral because people needed to turn to someone who could actually talk to them about what they were experiencing. So imagine taking your concepts and multiplying them 1,000-fold, 10,000-fold, right? So it's like a bienestar support group, right? Where people are able to talk about these things in a place where they feel comfortable, and seeing that the Latino community can have access to ways to do this. So I want to share that because I asked her to tell me how many individuals are associated with Alcoholics Anonymous in the United States. And there are 2 million people associated to that support group, 2 million people. And there are over 120,000 such groups in the United States. Mm-hmm. So just as we have found that these unresearched efforts that were developed to help meet the community needs can also be done in the Latino community, because we already do it. It's just that we don't quite have all the benefits of knowing how it's done, but you shortly have showed us how to do that. But now, how do people get help from you all? What's that going to look like? ¿Cómo le vamos a enseñar? How are we going to show people how to get access to you all? What's that going to look like? And so that people can hear, oh, mira, she told me I should do this, I should do that. Here's how I get there. Porque let's make the connection, the community resource and the people who need the services you have. So tell us more about how that happens.
Yeah, folks can reach out to us either through our website, our social media pages, which I know will be made available. But, because our work is led and guided by our community, we're always looking for folks to, come and say, like, this is what's needed, and then support us in co-creating that offering So if anyone here, if any listeners like, you know what, we need círculos, we need to talk about this, we need to add the drumming circles, right? Any of this is possible just because you're all saying it's needed. And that's ultimately all that we ask, that folks connect with us, that folks find a way to just identify what those needs are, or support us in identifying those needs. The other thing I also wanted to add was that a lot of our work does incorporate healing-centered practices. So before we even start the trabajo, we are burning medicine, we are singing cantos, we are just cultivating kinship with one another, because we know that is one of the cornerstones of our culturas, of wanting to recognize that our cultures do have value, they are worthy, they are sacred. Our communities know what they need. Our communities can be the ones to solve the issues that are impacting them, right? So that is our approach. And our hope is that folks feel empowered, knowing that when they come to Colibri, that they have an organization that treats them as valuable and sacred, members of an ecosystem. We are not alone. We are part of a larger ecosystem that includes our fiscal sponsoring organization, which is called Los Angeles Indigenous Peoples Alliance. And they are the fiscal sponsor. And then we have partner organizations like Chinachli and the Chinachli Comadre National Colectiva, as well as the Corazon Institute, who is in Texas. And then we're always doing work all over the country, talking about healing-centered work and healing justice work. So if anyone is interested in joining the work that we do, or even in supporting the work that we do, please connect with us, and we'd love to co-create with you.
Wonderful. Is there a physical office that people can go to, Dr. Patty, or everything should be just done through your website?
Yeah, we are 100% virtual. And we actually have folks all over the country. So we have folks team members that are in the Bay, Alaska. Yeah, we have a wide team. I think at one point we had someone in Mexico City and in Puerto Rico. So we're all over the country. And our hope is that our impact will be a transnational impact. So we're building that.
Wonderful. Itzpapalotl, was there anything that you would like to add?
No, I think Dr. Patty covered it all. Thank you.
Excellent. Well, such wonderful service. We have really, I think, learned a lot about your organization and what you guys are doing, not only here in LA, but as we hear, even estamos cruzando fronteras, right? We're crossing frontiers, right? We're crossing borders. If you have people in your network in Puerto Rico and Mexico, that is so wonderful, especially to have someone that can bring this type of information to our countries of origin as well, right? Because it is so needed. Again, our communities, not only here, but there, I believe, need this information as mental health now is not just, like you were saying, Dr. Pat, part of their personality, right? Oh, es que esa tía, esa es la tía loca, nomás no le hables, te déjala ahí en la esquina, nomás no la molestes, right? Don't bother her, just leave her, she's a little crazy. Or, like you were saying, solo es berrinchudo, he's just part of his personality, right? He or she is having a tantrum, right? So again, when in reality it may be that, maybe they are depressed, or maybe there is some anxiety going on, or maybe it's some ADD or some ADHD, right? That it's going on there. But yeah, no, definitely wonderful service. I think I personally have learned a lot today from your organization. I am sure going to be checking out your website and following you guys more to see the activities that you guys are doing and your offerings here in LA County. And we definitely are going to have to do more collaborations in the future. Fred, did you want to say some parting words? As our time is coming to an end, and this hour went by so fast.
I know. Talk about you had my attention the whole time, that's pretty good just to do that. But it was because I think you have the right formula, ¿verdad? And as you said, right, you're responding to what the community is asking for, and not many organizations will do that. So that's incredible. So let's leave you with some of the gratefulness and appreciation that people have expressed on this live Facebook, because it's a credit to you both for bringing these things up. So just want to share with you that one of your colleagues, Belen, says, so proud of all of your heart work, Dr. Patty Ramirez, exclamation marks. It's an honor to get to work with you. Dolores said, just wanted to share praises and bendiciones to all social justice work / mental health support in our communities. Deep bows, hermanas de luz. And of course, Dolores also ended with strength in numbers, Amori Luz from Tucson, Arizona. And we had listeners from California, of course, and also from our surrounding communities, because the community is not just in one geographic space. It's, as you said, global in nature, ¿verdad? The truth of our humanity is that we're all connected to each other in a global way. It's just that much of the action happens at a local place. But with that, I just want to say this has been an incredible opportunity to learn about how an organization starting from a community grassroots sprouts and then grows. And with that growth comes healing and the opportunity to serve others. And I just want to say in closing for today's Plática that I think you are basically modeling how we can fight stigma, and by talking about it, ¿verdad? Because we wouldn't say these things necessarily about people who are dear to us, right? So we want to have this open dialogue. Porque sabes que, not to be shamed or not to be hiding, but to be able to reveal the pain of what is our human reality, right? Sufrimos de vez en cuando, ¿verdad? Some of these situations are just that, it's a situation. Others, without getting treatment, can become chronic. So we want to prevent people from not getting worse, because people can, without treatment, potentially be harmed. So wouldn't we want to do an effort where we can protect and support and do no harm to people? So I think this Plática has been wonderful. I want to say thank you to all of you who listened in today. Again, this will be recorded and we will replay this. And we're going to continue to make sure that this is broadcast so that other people can hear today's Plática. Doctora Patty Ramirez, Itzpapalotl Patino, thank you so much for being with us. Of course, my colleague and my esteemed colleague, Ana Chavez Mancias, wonderful job as always to be able to have this open dialogue, esta conversación, esta plática, right? So that we can impart and share this with others. So with that, I want to say thank you to all of you, and we look forward to our next Plática. So join us again next week for the Pláticas and Take Action LA County. So we look forward to having you in that series coming up next week and the weeks after that. So with that, muchas gracias. Thank you so much.